Good evening, I'm Adrienne Arsenault. Tonight, reopening anxiety at the site of Canada's biggest outbreak.
The situation is not good, it's unsafe. I'm sorry about that.
I'm still a little bit scared.
Back on the job, but is it too soon? Why some workers say they still don't feel safe at this meatpacking plant.
I'm Andrew Chang. Also tonight, lifting COVID closures. From hair salons to patios to the eye doctor.
Everybody's a bit anxious.
What the new normal looks like as provinces start to reopen. New details about the moments before that Canadian military helicopter crashed into the Mediterranean.
The Nova Scotia woman who beat COVID at 100 years old.
Even if you're diagnosed, even if a loved one's diagnosed, there's hope. Don't count anyone out.
This is The National. More Canadians took their first steps into a new reality today, one shaped by COVID-19.
Several provinces started reopening. Some stores back in business, some rules relaxed, but the overall advice has not changed.
We still need to be extremely careful. So don't go out unless you absolutely have to. And if you do, keep 2 meters apart.
What's now open depends on where you live. And to put it simply, it's all an experiment. Everyone is watching to see what this does to case numbers. And make no mistake, there is concern it's all happening too fast. Tonight, we take a tour across Canada to hear the reaction, the worries, and how this virus could reshape our communities. Let's start with the site of the biggest COVID-19 outbreak in the country, the Cargill meat processing plant near Calgary. After a 2-week shutdown, today, some workers were back on the job, but as Carolyn Dunn reports, that does not mean they all feel safe.
You want a mask, a free baskets of information? Just you? Do you want one or two?
Cargill is open. At least some of its workers are reluctantly back on the job. Nearly half of them, 936, have contracted the coronavirus. One person has died.
80% of them said that they did not want this plant to open, and 85% of them said they were scared to come to work.
The union has been seeking a stop work order from Alberta's Labour Board to no avail. So with a pregnant wife, Freddie Jose is taking a month's leave of absence.
Before I go back to work, because I'm still a little bit scared because for my baby, right?
Cargill says working with provincial labor and health authorities, it has increased the safety at the plant.
They've always trusted us, and we're just asking them to trust us now. We're working really, really hard to keep our employees safe. We don't have a playbook for this. We wish we did. This is something that we're learning from.
But skepticism among returning employees is high.
But I want to see the situation. If the situation is not good, it's unsafe, I'm sorry about that.
Many of those who are returning are concerned history will repeat itself. Workers had sounded the alarm about unsafe conditions and felt pressure to work anyway. The plant closed temporarily after the death of Hip Wee. Today, her husband publicly mourned his loss through an interpreter.
I am so sad, up to the point that I'm speechless, because I know that I will not see my wife anymore.
Nan Nguyen says Cargill has not offered its condolences, but he hopes as employees go back to work, Cargill can control the spread of the virus so there won't be any more victims like his wife. Carolyn Dunn, CBC News, High River, Alberta.
Under Manitoba's reopening plan, everything from patios to hair salons were allowed to open with new restrictions. But as Kevin McIntosh shows us, just because they could doesn't mean they did.
The shop is finally back open, but the door is locked. This is what reopening looks like for Jeremy Regan.
The longer we are away, the less likely this place stays. Unfortunately for a small business, cash flow is everything.
With limited staff, he's just covering the bills. Working under stringent conditions, everyone wears a mask. Clients can't even wait inside.
I think people are so damn desperate to get a haircut that they're willing to almost do anything to be able to come.
While Manitoba's reopening is wide-ranging, its practicality is limited by physical distancing rules, as most places restrict access and hours.
You're getting served on a patio in Winnipeg. There's your special.
Example, for now, restaurants can only open patios.
So that is the red line from Toll.
Good enough for Kathy Teetart.
I'm happy that things are opening up. I'm just hoping that people will be compliant and follow the rules so that we don't have to take that step back again.
And that, warns the province, is a possibility.
It needs to be noted that this is not a return to normal, that this is a gradual and cautious reopening of the economy.
But many businesses say they just aren't ready. Masks and gloves are in short supply. Some don't feel safe.
None of us have enough equipment to go around right now. It's kind of insane.
So no, not normal times. But with apprehension, there's also pent-up demand.
I don't think I have any openings for the next probably 4 weeks right now.
Now, should this all work and the infection rate remains low, Manitoba could lift even more restrictions by the end of the month. Cameron McIntosh, CBC News, Winnipeg.
Now, next door in Saskatchewan, people can now access some medical services like the dentist or physiotherapist. Here's Bonnie Allen with what those providers are doing to keep their clients and themselves safe.
All right, come on in. We're going to have you go directly to the counter. There's some hand sanitizer.
Sandy Lucician is the first patient through the door at this optometrist office.
Thank you.
She was screened over the phone ahead of time.
They were very professional, asked me if I had a mask that I could wear, and I didn't really have any concerns about coming.
Patients are trying to book appointments, but this eye care center will only see half as many people and space them out.
Is that all right for you?
Perfect.
Still, Dr. Dorothy Berry says physical distancing is impossible for some eye exams.
You do the very best you can, you mitigate every risk you can, and you get your butt working, and that's the way to go. You have to get on with it.
Getting on with it includes a bunch of new rules.
If the client uses a washroom, they have to inform the front desk staff so that washroom can be disinfected immediately after. We've got an hourly process where we're cleaning everything every hour.
There's also the chronic challenge of finding enough personal protective equipment. Some dentists did not open today because they could not procure enough N95 respirators for emergency procedures that could put them at risk.
Everybody's a bit anxious. Where are you headed?
A spike in cases in the north means two communities, Lloydminster and La Loche, did not get to reopen any businesses. Saskatchewan reported 34 new cases today, its highest number in a single day, almost all of them in the north. Travel restrictions and highway checkpoints are trying to stop the spread. Bonnie Allen, CBC News, Regina.
And underscoring just how fluid provincial reopening plans are right now, a major part of Quebec's plan was pushed back today. Some retail stores in the Greater Montreal area were scheduled to open next Monday, but that has now been delayed by another week to the 18th over concerns there are still too many new COVID cases there. Montreal is now turning some city buses into mobile testing clinics to target hard-hit areas. There are outbreaks in the north and east ends. And Ontario approved some businesses to reopen today, including garden centres and nurseries, which have a very short window in which to make money. Jacqueline Hansen explains how tough restrictions are forcing some growers to throw their efforts away.
Tens of thousands of dollars worth of plants and months of work. Now, garbage.
Every day that this goes on, we get farther and farther behind. More and more of our crops start spoiling because we can't get it to our customer.
Thomas Elkema sells all his plants to garden centers.
These aren't close to spoiling yet.
But he says they're only buying a small fraction because the capacity for curbside sales is limited.
At this rate, we won't be able to sell even close to half of our product. If we're forced to be curbside, we're going to go out of business.
Rules for garden centers in Ontario amid COVID-19 haven't been clear-cut. As of today, curbside pickup and delivery are allowed, but some were already doing it. And some grocery stores have gone a step further. Loblaw garden centers are open to the public with physical distancing measures in place, similar to their main stores. This Ottawa nursery says that's unfair.
As you see, the 17-acre people spaced out. There is more space here than a garden center in a parking lot.
I thought it was unfair too,
The reason some of the big box stores were able to open up, they had pharmacies and food in it.
The Premier says there will be good news coming for the sector later this week, but more than a week ago, he said the same thing.
Many of these businesses have been scaling up and getting ready to open garden centers on hearing that good news was coming for them.
More delays could end up costing the sector hundreds of millions of dollars in lost sales.
Nearly every other province in the country is enabling garden centers to be fully operational right now. Ontario's the lone standout.
Still going to go bad by the end of the week.
For now, Elkema will try to sell what little he can and hope for better news.
We have a plan in place. We could jump on this tomorrow if we were allowed to.
Ready to ship whatever's left. Jacqueline Hansen, CBC News, Toronto.
The Canadian airline industry is also struggling. With its fleet largely grounded, Air Canada is hemorrhaging money. Today, the Prime Minister suggested help is coming, but no real details.
We need to continue to have a strong airline sector once this is all done. So, of course, we're looking very carefully at how to support industries like that are so important to Canada and to Canadians.
Air Canada announced today it lost $1 billion in the first quarter. To compare, this time last year, it posted a profit of $345 million. And as the company looks for efficiencies, it's also adjusting to fly in the age of COVID-19. Passengers will be subject to mandatory pre-flight temperature checks and must sit at least one seat apart until the end of June at the earliest.
Physical distancing was also in effect as the U.S. Senate returned to work today. That came as more states started easing restrictions. And as Paul Hunter explains, that led to a dramatic prediction about the number of pandemic deaths.
As America now increasingly reopens, so too its political epicenter. Today on Capitol Hill, now complete with physical distancing markers, the U.S. Senate returned to work. As Republican Senate Leader Mitch McConnell put it,
the essential workers that we are.
Members of the House of Representatives have not returned, still too risky, they were advised.
Meanwhile, just steps away from the Capitol building, in fact, literally just across the street, the Supreme Court of the United States is also back at work today, but with a twist.
Instead of hearing arguments in person,
oh yay, oh yay.
For the first time ever, it was by telephone.
We'll hear argument this morning in case 1946.
There was even a kind of conference call rookie mistake.
Justice Sotomayor?
Sonia Sotomayor seemed to have left her phone on mute.
I'm sorry, Chief.
And while D.C. itself remains all but shut down, today multiple states joined those now loosening restrictions, including Florida, where some seemed keen to be careful, but
I have not seen a lot of use of masks. And there are certain areas and certain times of day and certain places where it doesn't seem like social distancing is even a thing.
Still, with the U.S. economy spiraling, the pressure for other states to follow suit grows. Among those now set to do so, California.
End of the week, with modifications, we will allow retail to start operating across the spectrum.
Tonight, amid reminders to reopen carefully, a sobering projection from the University of Washington. 135,000 COVID deaths in America by August, double its previous projection. Why the jump? It cites the easing of physical distancing. Paul Hunter, CBC News, Washington.
Several European countries are also starting to reopen, including hard-hit Italy. After 9 long weeks of lockdown, these grandparents were able to reunite with their granddaughter. Italy is now allowing people to visit relatives as long as everyone wears a mask. Millions of workers were also able to return to construction sites and factories today, and restaurants can open for takeout.
Please download the app to protect the NHS and save lives.
The UK is not easing up restrictions just yet, but it is testing a new contact tracing app on the Isle of Wight. It notifies users if they've come into contact with someone who is experiencing COVID symptoms so they can get tested. The app is expected to roll out more widely later this month.
As the world waits for a vaccine, cities will have to adapt to a new normal. That means rethinking outdoor spaces, giving people more room to commute, to exercise, even to grab a cup of coffee. Chris Brown has that story.
In the Baltic nation of Lithuania, they're reimagining their capital for a physically distanced world, turning much of Vilnius into a big outdoor cafe, far beyond just putting people on patios, but taking over public spaces.
It was just a square, and now we dedicated this square as well for open-air cafes, and I'm pretty sure that it will be full of tables, keeping up the right physical distance as required.
Restaurant manager Imantas Lampinkas acknowledges being outdoors won't appeal to all of his customers, but probably just enough to keep his business going.
We're keeping the distance between the tables, staff are wearing the masks and the gloves, using sanitizer, sanitizing the tables every single minute.
If people are to get extra distance between them, Vancouver urban planner Brent Todderan says reconfiguring streets to find that extra space will be essential.
More space outside, on streets and sidewalks. The sidewalks won't even be enough. We're going to need to think about closing streets, using lanes, reusing space that has been used for other things.
Milan, one of the first big cities in Europe to shut down, is now reconfiguring its roads. Over the summer, it will transform 35 kilometers to give more space for pedestrians and cyclists under a plan it calls Strada Aperte, or open roads. In North America, Oakland is doing something similar, closing over 100 kilometers of streets, or 10% of the roads in the city.
I think that it's wonderful after, almost 2 months being locked in your apartment to enjoy the sun, coffee.
Of course, in places such as Lithuania and Canada, the weather is obviously a huge challenge for outdoor dining, but 1 week into it, customers seem prepared to bundle up. Chris Brown, CBC News, Vancouver.
As we focus on recovery, there's good news out of New Brunswick. By official count, it has no active cases of COVID-19, and there were no new cases recorded today in Manitoba, PEI, or Newfoundland and Labrador. But elsewhere in Canada, nearly 1,300 new cases today. Hard-hit provinces like Ontario and Quebec pushed the total to well over 60,000. Of nearly 4,000 deaths recorded, CBC News has confirmed 71% were in seniors' care homes. So given that sobering statistic, families are rightfully concerned for loved ones in those homes. And some would like to keep an eye on them through cameras and microphones. But David Common discovered some facilities don't want to allow that.
I know you miss us, right? We miss you too.
This is now the only way Robin Nelson and her sister can speak with their mother.
Hi, Mama.
And only when staff at her care home are able to set it up.
Did you have a good sleep last night? She is definitely suffering. She's not the same as she was before the lockdown.
Across Canada, people are desperate to see inside closed nursing homes. So Robin wants to install a camera in her mom's room along with a two-way radio to coach her through exercises.
So she's not alone. She doesn't feel alone.
She's asked the home, but says they've rejected her camera. And this seniors advocate and lawyer says the home is wrong.
Cameras are illegal from the video side of it as well as the audio side of it.
Most gut-wrenching thing.
Daniel Nasrallah knows all about it firsthand. A camera caught his own grandfather being abused by staff in a care home.
If you're not doing anything wrong, if you are providing proper care services to the resident, and if everything is kosher, then why have an issue with a camera being installed in the room at the family's request?
Extendicare, which runs Robin's mom's home, tells CBC News we take no issue with situating a camera recording device, but not one that would stream or record audio because it could impact a reasonable expectation of privacy for the neighboring room.
That's right. You've got to swallow.
But many lawyers say the home cannot block it, that families could post a sign to warn others a camera's in use, but that now, especially, is the time for a camera and mic.
Do you remember how much I love you? Isolation is killing our seniors, and something like a two-way talk camera could really help. And it's not just my mom, it's so many other people. Hopefully I'll get to talk to you again tomorrow.
With the pandemic worst inside care homes, it may be the only way some families can connect.
Bye for now.
David Common, CBC News, Toronto.
Well, 2 new outbreaks were announced today at hospitals in Ontario and Newfoundland and Labrador. Some 85 workers at St. John's Health Sciences Centre are in self-isolation after coming into contact with a COVID-19 patient over the weekend. The health authority says it's looking at how to safely resume some services at the facility. And the Ottawa Hospital is working to reduce the spread of an outbreak at its Civic campus after 4 staff members in the emergency department tested positive for the virus. The hospital insists, though, it's still safe for anyone to visit if they need emergency medical care.
North American beekeepers are raising the alarm about a new threat that some have dubbed murder hornets.
My reaction was, holy smokes, that's a big wasp.
Up next, the real deal about the giant insects everyone's talking about.
Plus, a potentially positive pandemic side effect: the benefits of making virtual medicine a reality for everyone.
And a remarkable recovery story.
Even if you're diagnosed, even if a loved one's diagnosed, there's hope.
The 100-year-old who beat COVID-19.
Don't count anyone out.
We're back in 2. Welcome back. We have new details about last week's deadly crash of a Canadian Air Force Cyclone helicopter off the coast of Greece. Here's Murray Brewster with what we know now about the moments before its tragic descent.
It must have been a horrifying moment. Crew members gathered on the flight deck of HMCS Fredericton, a routine training flight coming to a sudden, violent end in plain sight. The Canadian military acknowledged last week the relatively new Cyclone helicopter was on its way back to the warship when it inexplicably plunged into the water.
I can tell you that it was within around 2 miles of the ship, so within that distance.
It was, in fact, much closer. Close enough to be seen by perhaps as many as a dozen crew members who were on the flight deck preparing for the landing, or in a flight safety operations tower. There were eyewitnesses to the accident. As part of their investigation, the flight investigation team will conduct interviews with these eyewitnesses. It is not clear when those interviews will happen. The crew of the Fredericton held a solemn remembrance service while at sea, and a further departure ceremony for the remains of Sub-Lieutenant Abigail Cowbrow. The remains of 5 other missing crew members have yet to be recovered. The cause of the crash is unknown. Flight data recorders were retrieved and tonight have arrived at the National Research Council in Ottawa, where they will be analyzed. The helicopter wreckage is reported to have sunk in about 3,000 meters of water, and recovery will be complicated. The flight data recorders will yield only so much information about what was going on mechanically with the helicopter. The wreckage will help explain why such a routine mission went so quickly and suddenly wrong. Murray Brewster, CBC News, Ottawa.
Now, some other stories we're following tonight. BC RCMP have recovered the bodies of a 9-year-old girl and a 10-year-old boy after a terrible off-road vehicle crash over the weekend. Police say a family of 5 was riding near a lake when the vehicle slid off the road and into the water. 2 adults and 1 child were able to escape.
Please follow the directions, even if the water looks and smells like it did before the flood.
And Fort McMurray will be under a boil water advisory for several months. Officials say last week's flood caused the river to mix with drinking water, leaving behind a dirty film in nearly 400 kilometers of pipes that now have to be flushed and disinfected.
An insect with the nickname murder hornet is making its presence known on the West Coast. Spotted in BC last year and now Washington State, it is a real threat to bees. But as the CBC's Greg Rasmussen tells us, in rare cases, its stings can be fatal for people, too.
It's one scary bug.
They have a very formidable stinging apparatus, and they can inject quite a bit of venom.
Shown here next to a Canadian wasp, they originate in Asia, where they're nicknamed the murder hornet for swarming and killing people.
There have been significant annual casualties as a result of this defensive behavior of these hornets. You're talking about a few dozen people every year, at least in Japan.
Another fear is the impact on already troubled honeybees, which the Asian hornets can quickly decimate.
Damage will occur, there's no question, but I think that beekeepers are pretty savvy operators and will deal with them successfully.
So far, the giant hornets have been found at 2 locations in BC and more recently in northern Washington State. The nest found on Vancouver Island contained about 200 of the creatures. Beekeeper Conrad Berube was sent to remove it.
Oh, that's the queen?
So. Let me see.
Oh, look at her.
My reaction was, holy smokes, that's a big wasp. And they are, in fact, the largest species of wasp on the planet.
But he paid a big price despite his protective beekeeper suit.
The enraged hornets immediately stung me across the tops of my thighs. It was like having red-hot thumbtacks driven into one's flesh, and not everybody is into that. So it was quite painful.
Not many left, though.
He was stung 7 times, even through a thick leather glove, and he still has the scars from its powerful venom. The hornets likely arrived on cargo ships, later setting up nests deep in the forest, eluding efforts to find them.
At this point in time, really what you call the needle in a haystack. This is really tough.
But tracking them is important before more emerge and reproduce. Greg Rasmussen, CBC News, Vancouver.
Still ahead on the national, move over, stay the blazes home. Now the premier of PEI has some t-shirt worthy words for COVID-19 in our moment.
And in just a moment, we are going to have Dr. Isaac Bogosh linking up with us to take your COVID-19 questions. We've got a couple about all the reopenings happening across the country. Also this one about when you're at the grocery store. Which is safer, cashier or self-checkout? The answer's after this. Welcome back. Time for your COVID-19 questions. With parts of the country slowly reopening, your questions keep coming in. So joining me tonight to help answer them, infectious diseases specialist Dr. Isaac Bogosh. Dr. Bogosh, let's get started. And here's a big question to start things off. Is it safe for so many provinces to be reopening?
Yeah, I think it is. It just has to be done carefully and, of course, at the right time. And we know certain provinces are farther along than others. Just for example, New Brunswick is much farther along than many other places. And I think in many places that are farther along, it is safe to reopen. It just has to be done in a very careful, slow, gradual manner. And any place that's reopening, I think people have to be aware that you might move one or two steps forward, but if there's an unacceptably high number of new cases, you might take a couple of steps backwards as well.
Right, and that takes us to the second question. Will there be a second lockdown?
Yeah, a lot of that is completely dependent on us. And if we really adhere to the physical distancing measures in this new normal, as we gradually shift that dial or that dimmer switch towards fewer and fewer public health restrictions, if we are still able to maintain physical distancing and practice good hand hygiene, we will hopefully be able to avoid a second lockdown. But if people are clustering together, and if we see, pockets of infection and these pockets start spreading to other places, yeah, we might see a second lockdown. I think we all have to be mindful that that is a very real possibility.
But so in terms of adjusting to the new normal, here's another question that came in. At the grocery store, which is safer, cashier or self-checkout? And that's sort of an interesting question, right? Because one option, I suppose you're coming into closer proximity with people. The other one, you're using a high-touch device.
Yeah, I think people might argue with me on this one, but I honestly feel like we're splitting hairs here, and that either is going to be totally acceptable as long as we adhere to these principles of good hand hygiene. And as long as, once you've completed the transaction, you go about your way, but you make sure that you wash your hands. And even in the checkout aisles, we're seeing plastic shields that are in place that are really protecting employees and also protecting customers as well. So I think that either or is going to be just fine as long as people are still adhering to their principles of hand hygiene and physical distancing as much as we possibly can.
All right, good questions, good answers. Dr. Bogosh, thanks again.
Have a good one.
And so, as we've mentioned, we will be asking your questions about COVID-19 as often as we possibly can, so keep sending them in. You can message us directly on Instagram at CBC The National or send us an email at covid@cbc.ca, and just be sure to put The National in the subject line.
The pandemic has forced many of us to shift our life and work online. Now that's expanding to healthcare. This weekend, the Prime Minister announced a nearly $250 million investment so more Canadians can access doctors over the internet. Health reporter Vic Adopia shows us what that change could look like.
There are no patients waiting at this children's hospital. They're seeing doctors online, even for non-life-threatening urgent cases.
We've received a request to have a virtual visit with one of our pediatric physicians here.
Now that all provinces and territories have agreed to pay for phone and video doctors' visits, virtual care has taken off.
And put your finger, and it will help us monitor your oxygen levels.
For some patients, online visits are even preferable.
If anything, there's just greater benefits with having less stress. Again, breaking down those barriers of driving, parking, frequency of appointments.
Canada was considered a pioneer in telemedicine.
Doctors to prescribe help for patients who would otherwise be isolated.
But the uptake in our public healthcare system had been slow, usually limited to rural and remote medicine, so private virtual health apps have thrived.
What if you could be talking to a doctor in 2 minutes or less from the comfort of your home?
Now it's not just hospitals temporarily offering virtual care, but family doctors too.
The healthcare system had stalled for a really long time, and we've just seen a massive explosion during the time of this pandemic.
In a recent report, Canada's doctors called on Ottawa to make virtual care a priority and set national goals and standards instead of relying on a patchwork of programs and pilot projects. But when it's safe to go back to the office, doctors and patients may not be ready.
This pandemic can be a catalyst for better care in Canada.
by implementing more virtual care, because it has really shown us that the desire's there, the need's there, and we can do it.
Like so much of this outbreak, interim measures could be the new normal. Vicadopia, CBC News, Toronto.
Next on The National, we don't know just how much this pandemic will change the world we live in, but there's someone who's made a living learning from the lessons of the past. Historian and philosopher Yuval Harari on the meaning of the moment we're all experiencing and what the future could hold.
But first, an important part of the story of COVID-19 is what happened before, the lives victims lived before the virus struck. CBC News is telling those stories through a series called Lives Remembered. And tonight we focus on Clark Campbell through the memories of his wife.
My name is Gail Campbell, and I lost my husband, Clark Campbell, to COVID on April 14. He had turned 76 2 days before that. Clark was the best thing that ever happened to me. I met Clark on a blind date when I was 19 years old. He was a civil engineer, but his first love next to his family and any dog was woodworking, being at the cottage, loved to fish in the lake every day and caught nothing usually. And then one day he caught the biggest fish I ever saw in my life. And everybody was congratulating him, and all I could think of was, oh my gosh, how am I gonna cook this? He was kind, he was gentle, and funny as heck. Oh my gosh, we laughed every day. The disease he has is limbic encephalitis, and Clark had been having a lot of trouble with his spine. The idea of surgery was tricky. On March the 2nd, they were able to do the surgery. It was very successful. He'd been in the hospital several weeks, and the doctor told me Clark had COVID-19 and would not be coming home. If I could have been with Clark at the very end, I would have said that I am truly blessed that he chose me, and we had a wonderful life with our family, and we had joy, and that I heard very clearly the last statement when he was able to talk. Take a deep breath and know that you're loved. Clark, I will.
Clark Campbell's life, one of thousands claimed here by this virus. And through Lives Remembered, we are trying to tell the stories of as many as we can. So if you'd like to share with us the story of a loved one you've lost, reach out to us at covid@cbc.ca.
This pandemic no longer feels new. The world has been wrestling with it long enough now that patterns are starting to appear. Ones that may offer clues to how we're changing, and the news might not be all bad. Famed Israeli philosopher Yuval Harari, long a student of human behavior, says what he sees in us all now impresses him a bit, and we have more choice in our future than we might realize. Maybe it's a matter of perspective. You can look at the way the world has retreated indoors and say fear has done this. Or you can marvel at this moment the way philosopher and historian Yuval Harari does.
Toda rabah, Yuval.
It's my pleasure.
Harari sees hope in what otherwise might look like deserted places, particularly those empty houses of worship.
You know, in Israel, they closed down the synagogues. In Iran, they closed down the mosques. Churches all over the world are telling people, stay away from the churches, because the scientists said so, because they believe the epidemiologists and the doctors.
Consider the scorn heaped upon it by populist governments in recent years. Distrust in vaccines so pervasive, dangerous illnesses like measles have been on the rise. But now, science commands action.
Almost everybody everywhere are turning to science as the most reliable source of guidance. The big advantage of humans over viruses is that we can cooperate in ways that they can't. A virus in China can't give advice to a virus in Canada or the US about how to infect people. But Chinese doctors or Korean doctors or Italian doctors can give good advice to the Canadians and the Americans.
Cooperation is not a given now. Look at the battles over countries hoarding personal protective equipment.
The N95 respirators, surgical masks, gloves, and other personal protective equipment. We need these items immediately for domestic use. We have to have them.
You can sort of understand the impulse to keep what you need for yourself, to keep your supply chain within your own country.
But that's a terrible impulse, because maybe they have the masks, but they need other things. I mean, if we are thinking globally, then global cooperation will make production far more efficient, reducing bottlenecks and competition.
South Korea has had considerable success in lowering its COVID-19 infection rate.
Cooperation is also self-interest. Helping other countries avoid the worst effects also ensures there aren't new waves of the virus to import. All nations need advice now.
Now, countries like China and like South Korea are experimenting exactly with these exit strategies. Some things work, and some things may turn out to be a mistake. Now, you don't want to just repeat the same mistakes in 2 months in North America. So you need to be in a situation when you can get good, reliable information and advice.
And be impressed, he suggests, that COVID-19 has proven change can happen fast. Societies fought for decades over a guaranteed basic income and are very close to just doing it. Learning or working remotely is instantly mainstream.
When I hear people here talk, I hear a lot of helplessness and a lot of despair. I don't hear any of those things in your voice.
For most of history, the basic cultural reaction to an epidemic like the Black Death was resignation. This is part of nature. This is God's plan. We humans can't do anything about it. The modern world is very different. We believe in our power to postpone death and to overcome epidemics. We also have a lot of hope. The question on everybody's lips is, when will the vaccine be ready? Not if, but when.
In the face of so much loss, to believe in the good takes effort, even faith. Ruinous missteps, especially political ones, are possible. But Harari sees another way: cooperation, intelligence, potential legacies of COVID-19 we don't talk about enough. Next on The National, more cause for hope.
This is Kay Murphy. She just turned 100, and what's more, she just recovered from COVID-19. Her story right after this. In the midst of a deadly and frightening pandemic, this is the face of hope. At age 100, Kay Murphy has survived COVID-19 after catching it in a Nova Scotia care home. Her family was devastated by the diagnosis, on tenterhooks for 2 weeks, but now they tell Kayla Hounsell how grateful they are to talk about her recovery as an affirmation that this virus can be beaten.
At 100 years old, Kay Murphy still reads the newspaper every day.
I like to keep up on what's going on.
She read about COVID-19 too, and then contracted it herself.
I didn't want to do anything.
Murphy lives at the Northwood Long-Term Care Home in Halifax, the epicenter of Nova Scotia's COVID-19 outbreak. 32 residents have died.
It was almost like a ticking time bomb. You know, when is she going to get it?
And when that news did come, her family expected the worst.
When I initially heard the news, I spent several hours crying.
And we just kept thinking about what we were going to, how would we do things when she passed away.
See this part here?
Murphy had a sore throat, a fever, and difficulty breathing.
You're sitting on pins and needles all the time, waiting for that phone call, you know.
So then you got the phone call, but not the one you were expecting.
Got the phone call, and that was pretty exciting.
Murphy has now tested negative for COVID-19.
The nurses said that her lungs are better than half the staff that work there. She's just completely recovered.
Her family is sharing their happy ending because they think Nova Scotians need some good news.
We've been hit pretty hard in the last 3 weeks, Nova Scotia. We think it's important that people know that good things do happen to us. So, and it is a good thing.
They also have a message for others dealing with the virus.
Even if you're diagnosed, even if a loved one's diagnosed, there's hope. You know, don't count anyone out.
Murphy turned 100 during the pandemic, which meant the large gathering the family usually plans for her birthday didn't happen. But they say it will, just as soon as it's possible. Kayla Hounsell, CBC News, Halifax.
That's fantastic. The moment is next. The Premier of PEI's new, very relatable COVID catchphrase.
But first, our latest COVID-19 how-to guide. We know a lot about how you can get sick from secondhand smoke, but if you're close enough to breathe it in, could the coronavirus sneak in too?
I wouldn't rule it out. I certainly wouldn't rule it out.
The problem is this. We know this virus is spread primarily through droplets, and so when you sneeze, for example, they plume out, a bit like cigarette smoke actually, before those droplets fall.
If you're close enough to be inhaling someone's secondhand smoke, you may be close enough for this to be transmitted. Certainly you're within that 2-meter radius, which is not where we should be.
So how about if you're farther away, but you can still smell the smoke? Well, experts say you're probably safe. That's because smoke particles are small and light. That's why they waft about. Viruses in droplet form are heavy. So a virus, a droplet hitching a ride on smoke is a bit like an elephant hitching a ride on a balloon. And in any case, as with smoke exposure, generally the smaller and shorter it is, the less risk to you.
3 months into the COVID-19 pandemic, and few people obviously have anything nice to say about it, but the premier of one of Canada's friendliest provinces is now dropping F-bombs, in a manner of speaking. We're not sure whether PEI is simply trying to top Nova Scotia's famous COVID catchphrase, but the salty language does inspire tonight's moment. So remember this?
Stay the blazes home.
Well, Stephen McNeil, Dennis King just went next level.
And I want to find a way to say, F you, COVID, we're still going to do this.
You do know that's going to end up in a T-shirt now.
And guess what? Thanks to local entrepreneurs Joel and Jeremy Watts, it has.
He said something about F you, COVID, and about an hour later we had a T-shirt ready to go. We have them on our online website, so people have been ordering them from all over Canada. We just thought people would get a kick out of it, and it kind of gives everybody a little bit of a laugh.
And as for Premier Dennis King himself,
we're actually going to get him one, so he probably won't have to pay for his.
I mean, we all want to say it, right? Okay, so Joel and Jeremy are not only smart, they're very kind, because each person who buys a T-shirt, Andrew, gets a $10 gift certificate to a local Charlottetown business. If they ever use that.
It's such a great idea. And you know, the beneficiaries are local, clearly, but the appeal is universal. They mentioned about how it's kind of picked up across Canada. They've even sold shirts in the United States, and they think they'll just get busier yet. That's The National for this Monday, May 4th. Good night.
Good night.